Hello and welcome. We know that hearing the words anal cancer can be really daunting, but we also know that knowledge is power. So in this explainer, we're going to break it all down. What it is, how it's treated, and what you can expect. We use these slides to guide us through it step by step.
Look, it is completely normal to feel overwhelmed right now, and that is absolutely okay. The whole point here is to take things one piece at a time so you feel informed and, hopefully, a little more prepared for the journey ahead. We're going to walk through this together.
Okay, so let's get right into it, starting with the very basics. What exactly are we talking about when we say anal cancer?
To put it simply, anal cancer is a cancer that starts in the cells of the anus. Now, you'll hear doctors talk about two main locations. One is inside the anal canal itself. The other is on the skin right around the anus. That's called the perianal area. And that little distinction is actually pretty important because it can help guide the treatment plan.
Now, what's really interesting is that one type of anal cancer is way more common than all the others. As you can see, about 85% of all cases are what's called squamous cell carcinoma. And because it's the vast majority of cases, that's the type we're going to be focusing on for the rest of this explainer.
All right, next up, let's talk about two of the biggest questions people usually have. What are the signs to look for, and what are the known risk factors?
You know, the tricky part about the signs of anal cancer is that they can often look a lot like other, much more common things like hemorrhoids. The real key to pay attention to is if the symptoms stick around. If you have any of these signs and they seem to be getting worse over a few months, that's your cue to go see a doctor and get it checked out.
When we look at what causes it, one thing really stands out above everything else: the human papillomavirus, or HPV. It's considered the major driver behind most cases of anal cancer. Now, other things like smoking or having a weakened immune system can play a role, for sure, but the link to this very common virus is by far the strongest.
So how do doctors figure out for sure if it's cancer? Understanding the process can really make it feel a lot less scary. Your medical team has a very clear, logical plan to get a full picture of exactly what's going on.
It all starts with a careful physical exam. If the doctor finds anything suspicious, the next step is a biopsy. That just means taking a tiny little piece of tissue to send to a lab. Honestly, that's the only way to know for sure that it's cancer. From there, imaging scans like a CT or a PET scan help the team see just how big the tumor is and if it has spread anywhere else in the body.
Now, you're probably going to hear the word staging a lot. Don't let it intimidate you. It's really just a system that doctors use to describe the cancer. They look at three things: the size of the tumor, or T, whether it's spread to nearby lymph nodes, or N, and if it is spread to distant parts of the body, which is M. Knowing the stage is what lets them build the absolute best treatment plan just for you.
Okay, let's get to the most important part, the treatment plan. The way we treat anal cancer has changed so much over the years, and really, it's all for the better.
A generation or so ago, the answer to this question would have been very different. A lot of people hear cancer and immediately think of a big, major surgery, but is that actually the case for anal cancer today?
And the answer, for most people, is a very clear and hopeful no. This is a huge deal. For the vast majority of patients today, major surgery is not the first thing they do. And this shift has made an incredible difference in both survival and in people's quality of life after treatment.
So if not surgery, then what? Well, the modern standard of care, the best, most effective approach we have right now, is a combination treatment called chemoradiotherapy. This has become the gold standard, and it is incredibly successful.
And the reason it works so well is because these two therapies work as a team. Think of it like this. Chemotherapy is a medicine that travels all through your body, kind of like a patrol, hunting down any cancer cells. At the same time, radiation acts like a high-powered, focused spotlight, aiming beams of energy right at the tumor to destroy it. Together, it's a really powerful 1-2 punch.
And none of this is guesswork. These treatments are incredibly precise. For instance, we know from studies that a minimum radiation dose of 45 Gray, that's the unit of measure, is needed to really be effective. Your team will carefully plan out every single detail to give you the best possible chance of success. So, what happens once treatment is done? Well, the journey doesn't just stop there. The next phase is all about healing, recovery, and careful monitoring.
Now, this is a really important point, and I want you to hear this. The radiation actually keeps working in your body long after your last appointment is over. It is totally normal for the tumor to shrink slowly over time, and it can take as long as 6 months before it's completely gone. So patience is absolutely key during this healing phase.
And you're not alone in this. Your team will have a very clear follow-up plan for you. You'll have your first big checkup a few months after treatment, and then regular exams for the next 5 years. This careful watch is all designed to catch any potential issues as early as possible and just give you peace of mind.
I want to end on this quote from a major surgical textbook. It says that while these cancers are on the rise, the most important words to focus on here are imminently curable and favorable outcomes. With the treatments we have today, the outlook is very, very good. There is absolutely every reason to be hopeful.